Hello, friends. Welcome to another episode of Listen, Learn, Live Better with Sushmita. So, the health related talk show that I have already initiated in my YouTube and my Facebook, thank you everyone for supporting it. So, as 6th May is World Asthma Day, so today's topic is related to asthma. May 3rd, today's topic, asthma. Take control of asthma, let not it control you. So what is asthma? The first thing first, we must know what asthma is. Asthma is a condition in which your airway narrows and swells and may produce extra mucus. This extra mucus can cause breathing difficulties and trigger coughing, a whistling sound that is called wheezing, and when you breathe out, and shortness of breath. For some people, asthma is a minor nuisance. For others, it may be a major problem that interferes with daily activities and may lead to a life-threatening asthma attack. Asthma can't be cured. Just to be very honest, asthma can't be cured. But its symptoms, we can control it. Because asthma often changes with time, it's important that you work with your doctor to track your signs and symptoms and adjust your treatment as needed. So what is an asthma attack? How will you know, or how you can help people when you have the asthma attacks? What are the signs and symptoms that we have to look up? When you breathe normally, muscles around your airways are relaxed, letting air move easily and quietly. But during an asthma attack, 3 things can happen. Number 1, bronchospasm. What is that? The muscles around the airways constricts or tightens. When the muscles tighten and makes your airways narrow, air therefore cannot flow freely through these constricted airways, which causes bronchospasm. Number 2, inflammation. What is it? The lining of your airways becomes swollen. Swollen airways don't let as much air in or out of your lungs. And number 3, mucus production. During the asthma attack, your body creates more mucus. The thick mucus clogs the airways. When your airways therefore gets tighter, you make a sound called wheezing when you breathe, a noise that your airway makes when you breathe out. You might also hear that the asthma attack called exacerbation or a flare-up. It's a term for when your asthma is not controlled. So what are the symptoms that we can look for? Asthma can be different for different people. Asthma symptoms can also vary over time, with few or no symptoms when asthma is well controlled. The common signs and symptoms of poorly controlled asthma includes shortness of breath, regular coughing, wheezing, chest tightness, increased mucus production, trouble sleeping because of breathing difficulty, being unable to take part in physical activities without that shortness of breath. These symptoms can occur slowly over hours or days, or they can come on as sudden recurring attacks. There are some asthma triggers which we should be very careful about. A trigger is anything that irritates your airways. Asthma is caused by 2 types of triggers. Number 1 is allergic trigger. That causes allergic reaction. Allergic triggers include things like dust, pollens, molds, pet dander, These are very common during this spring season. And another can be the non-allergic trigger. They are usually the irritants like smoke, cold air, certain air pollutants, and sometimes intense emotion also. So, how is asthma diagnosed? First, the doctor will do a physical exam to rule out the possible conditions such as the respiratory infection or chronic obstructive pulmonary disease, that is called the COPD, we are most commonly aware of. The doctor will ask the questions about your signs, the symptoms, and about any other health problems. Now, after that, the tests is sent by the doctor or is recommended are the lung function test or the pulmonary function test. It determines how much air moves in and out as you breathe. Like the common pulmonary PFTs are the spirometry, peak flow, like this. Now, on this World Asthma Day, that is on May 6th, WHO, that is World Health Organization experts, offer 5 tips to how to manage your asthma. So if you know these tips, you can take control of the asthma. Number 1, be aware of your symptoms. Cough, wheeze, and difficulty breathing are all symptoms or signs that the asthma is not well controlled. If you feel that your symptoms are getting worse, follow the instructions that are given by the doctor. Like, the doctor may prescribe inhalers like the Ventolin or the salbutamol inhaler with a spacer that opens your airways. Number 2, identify and avoid the triggers for your asthma. Common triggers that includes, I told you, that is smoke, fume, viral infections, pollen, dust, changes in the weather, animal fur, feathers, and strong fragrances. Know what affects and what causes the trigger for if you are facing any asthma. Make sure you have your inhaler with you always. Number 3, know your inhalers. A reliever inhaler is what is a reliever inhaler? It is also called the bronchodilator. It opens the small airways and improves the airflow in and out of the lungs. Use this when you have the symptoms. Another kind of inhaler are the steroid or the preventer inhaler that reduces the inflammation in the lungs and essential part of long-term asthma treatment. By using a steroid inhaler as directed by your doctor, definitely, you will improve the symptoms and reduce the risk of severe attacks. So inhalers are the safest and the most effective treatment for asthma. Use a spacer. What is a spacer? A spacer is a plastic chamber which connects the inhaler at one end and your mouth via a mouthpiece or mask at the other end. Why use a spacer? It can help the inhaled medication to reach the small airways in the lungs and work better than when we just directly pump it in our mouth. The spacer allows more time for the medicine to be breathed in and means that less coordination is required. Without a spacer, you have a breathe in deeply and press the inhaler at the same time. Inhaled medicine often ends up in the mouth or throat and is ineffective. It doesn't reach the space or the small airways that needs to be dilated. Some types of inhalers do not need a spacer. There are some dry powder inhalers. But check with your doctor whether you need the spacer, whether it is good for you or not. Very important to distinguish between bronchial and cardiac asthma. This is another one that I wanted to touch base on today because we don't really understand that which is caused by lung and which one is caused by heart. Bronchial asthma is another name for asthma. The term bronchial is associated it is used to differentiate it from the cardiac asthma, which is not a form of asthma, but actually breathing difficulties caused by heart failure. In the very first episode, I had told you about this, that you have to stay up. The symptoms represent like asthma, but they are not. I had also given you the example of my father. My father was a patient of cardiac failure or heart failure, but the doctor had misinterpreted him as a bronchial asthma. So I have my practical experience in this, and I would never ever want anyone to ever suffer from a cardiac asthma. So just learn which is bronchial asthma and what is cardiac asthma. Although the two conditions have similar symptoms, that is the shortness of breath, wheezing, they have quite different causes, and so the treatment is also different. When I'm just talking about the cardiac asthma, let me just give you some examples. Cardiac asthma is really a set of symptoms caused by congestion or fluid buildup in the lungs, that is the pulmonary edema resulting from heart failure. It is more common in older people or the aged or seniors. In cardiac asthma, the reduced pumping efficiency of the left side of the heart, mind it, left side of the heart where there is the oxygenated blood, leads to build up fluid in the lungs. This fluid buildup causes breathlessness and wheezing. And what are the symptoms of cardiac asthma? They are similar to, they mimic the bronchial asthma. They are same as shortness of breath, wheezing, dry cough, rapid and shallow breathing, frothy or watery sputum, coughing up sometimes blood-tinged mucus, and the symptoms gets worse at night. Very important. The pattern of shortness of breath can help doctors determine which condition the patient has, whether it's a bronchial asthma or whether it's a cardiac asthma. People with bronchial asthma tend to experience shortness of breath early in the morning after getting up from sleep, whereas people with heart failure or cardiac asthma often find they wake up suddenly breathless a few hours after going to bed and have to sit upright to catch their breath. This is a classical example of cardiac asthma symptom. This is because why the people have to sit the whole night to catch their breath for cardiac asthma, because lying down for prolonged periods will cause the fluid to accumulate in the lungs, leading to the shortness of breath. If they sit in the bed for a while, the symptoms may subside. So both asthma and heart failure can make people short of breath when they exert themselves. So in bronchial asthma, symptoms are usually brought on by vigorous exercise and tend to worse after the exercise than during it. On the other hand, the cardiac asthma tends to happen during less vigorous exertion also. Someone with heart failure can find themselves short of breath and wheezing while climbing stairs, or in severe cases while getting dressed. So what are the treatments for cardiac asthma? The treatment for cardiac asthma is essentially to treat the cause of the underlying heart problem, whether it be the heart failure or the leaky valve and the excess of fluid in the lungs. People who awaken suddenly in the night with symptoms of cardiac asthma may improve the situation by sitting upright for about half an hour. So there is no evidence that using bronchodilators will help in cardiac asthma, and they may even worsen the situation. I today touch based on two types of asthma, that is the bronchial asthma and the cardiac asthma, because I have seen my father suffer from cardiac asthma, and I don't want anyone out there to suffer from it without noticing the symptoms. I hope this part of the talk show, Listen, Learn and Live Better with Sushmita, will help you distinguish whether you see anyone with cardiac asthma or with bronchial asthma. Breathing should be easy for everyone. So support the World Asthma Day. Thank you everyone for listening. Just keep tuning for another episode coming up again next Saturday in Listen, Learn, Live Better with Sushmita. Stay safe, stay healthy, remain positive, and good things will happen to you. Bye for now.